Bienvenidos y bienvenidas a Frugal for Health, una iniciativa que busca dar a conocer proyectos frugales de todo el mundo. Si esto de la innovación frugal aún no sabes de qué va de conseguir más con menos. Y te dejo un vídeo de Navi Rajao que lo cuenta muy bien cómo hacerlo en el sector salud y social. Hoy me encuentro en Nairobi, en Kenia, en el Hospital de Kasarani, para conocer una figura que siempre me pareció muy frugal, los trabajadores de comunidad. Unos agentes que viven en las comunidades y que su rol es acercar a esas familias a los diferentes servicios que le puede ofrecer el país. Salud, economía, violencia de género, siempre desde la perspectiva de la prevención. Acompáñame a conocer una de las organizaciones que fomenta el empoderamiento de estos trabajadores de comunidad y que también está haciendo un trabajo magnífico acercando a las comunidades de refugiados que viven en Kenia de los países vecinos. Si quieres un poco más, te dejo con un debate con agentes interesados en el proyecto de la mano de la organización española Pharmamundi. ¡Hasta pronto!
My name is Eunice Achieng. I work with the Foundation for Health and Socioeconomic Development Africa, also called Social Africa. We work in Kenya with vulnerable communities in mainly sub-counties that are with refugees. In our organization, and we as work with Esta Africa and Pharmamundi, frugality means working with less for more. And this means reaching out to a large population with a little number of people. Community health workers are health promoters who are within the Kenyan system working in what we call level 1. Level 1 is at the community level. They live in the community, they work in the community, they know their community. They have work and they are volunteers who really understand the community in matters health promotion and prevention. They reach the community on matters gender-based violence advocacy, and their work also involves reaching out to an average of 100 households within their area of coverage. If you, for example, you are a pregnant woman and you access the health promoter, she or he is able to tell you where to go to seek for health services, your nearest health facility. She is able to explain to you what are the danger signs that if you see as an expectant woman that you need to call her or get in touch with one of them to be able to refer you to the hospital. The health promoter has this specific book which we call MOH 100. This is a referral notebook that if you approach her, she's able to note down your name, your details, your gender, and what you're suffering from. She can give you this basic book paper to go to the health facility. So they're the first contact with the community at that level to be able to refer back to the health centers. This 2024 has started giving them some stipend, an allowance for them to work. As an organization, we also work with them and we give them an allowance so that they're able to cater for their basic needs and also their transport as they do their work. Then they're able to reach and create this awareness and advocacy within their churches, their schools, their riders' base as the riders are waiting, or the women who wash are waiting to wash. They're able to talk to them a lot about this. We also work with the refugees, urban refugees. Not easy to access because of their situation and for allowing any foreign person to get into their house. So as an organization within our program with Pharmamundi, who are working with the refugees to access health services, we saw it fit to also enroll a few of the refugees who had a background of health to be able to work very closely within their households. And this has really oriented the program so well, and we've been able to open doors even to improve the indicators for government within the refugee households in the urban setup in Nairobi. Each health promoter is able to access at least 100 households. We use them also, or we work with them in link with our social workers and also health promoters, and also our psychosocial, mental health social workers.
His name is Gaspard, and the reason why he wanted to join this community health promoters is because most of the refugees, they were not able to, when they were coming to the hospital, they were not able to express themselves because of the language barrier. Most of them are Congolese, Rwandese, Burundians. We have some from Southern Sudan. We also have from some few Somalis around. So they took up that task of coming and supporting their community to get the services that are required. The other reason why they also chose that is because they wanted their community also to benefit from the services of the community, or rather from the government. And since they started now moving around in the community with the megaphones, the other fellow now refugees are able to come to the facility. They're able even to be there and to support when they are not able to express themselves to the doctors. They come in and they're able to support them, and they get the right services. Even when they are given medication and they don't know how to use them, or rather they don't know what exactly is supposed to be done, they're able to follow up in their houses and tell them, this is the way you're supposed to take the medication, this is how the child is supposed to be taken for clinics and so forth. So their work mainly in the community is to link the refugees to the services that are offered within the health facilities.
Yeah, community promoter is identified from the community, and it has to be somebody who is faithful and who doesn't have to talk about the issues that you get from one house to another. So it's somebody that is respectable, and then again it's somebody who is who understands that he has to link issues, health issues, from the hospital to the community, from the facility to the community. Immunization, there is family planning, mental health, we have nutrition, maybe even aging, PWDs, people living with disabilities. When we identify them, we refer them to the facilities.
Health promoters who are already linked with the community and they're able to be in touch with this household on a real-time basis. They live there, they work there, and they're able to know these women, these children. They're able to get this information real time. Somebody who got violated like the previous man, they're able to call them to be able to refer them to the facility. We use an existing system that is already there. When we train this one woman or one man in matters of health promotion, for example, I'll give example of washing hands. She's able to go and train all these households, and each household, for example, has 5 persons. So if a health promoter is one reaching 100 households, and each household has 5 persons, so that is one health promoter teaching 500 people on just hand washing. So this is how frugal the project, in terms of using health promoters, really works in our project here in Africa. If it is a child going to school, they don't have information, we're able to refer and link them to the right places. If it is a woman looking for hospital, we'll be able to refer and link them to the same. And if it is someone who wants to report a case of gender-based violence to the police, we're able to link them with information on the same. And within our project also, we have a team of paralegal who are able to walk with them to the police stations, for example, or to do the reports at the facility levels. So in that context, then the project is working horizontally within the community at that level to be able to promote health-seeking behavior, promoting access to the health services, and also above that, just promoting other social amenities that would be needed, basics within their household level.
Pues hasta aquí la entrevista a los trabajadores de comunidad del Centro de Salud de Kasarani en Nairobi. Ha sido súper interesante poder conocer cómo esta figura está tan extendida en el África y cómo puede también inspirar a otras regiones. Espero que os haya gustado y si queréis un poco más os dejamos un debate para profundizar sobre el tema. ¡Hasta pronto!